First of all, I'd like just to give a brief introduction on myself. I'm actually Brazilian, but I'm living in Portugal. So my parents are Portuguese, and I have a mixture of cultures because I was grown up in Brazil. I spent 20 years in Portugal, and for the past 10 years, I've been working for UK companies. And I've been involved in the stem cell banking industry for about 10 years now. And I've been very fortunate to be one of the first to be involved in this revolutionary industry from its early beginnings, which means that being involved in international business development, I was able to see firsthand the challenges that the industry was facing in different countries, and then being able to build the solutions to resolve these same challenges and these same problems. So WideCells Group, we are a worldwide provider of stem cell services. And we've established 3 business divisions. CellPlan is the world's first stem cell insurance plan to cover all the costs associated with stem cell treatments. We have also developed the world's first expert medical opinion service for stem cell treatments and the medical concierge service to arrange for travel, accommodation, hospital admission processes, visa arrangements from patients that are flying, for example, from India to the US to receive the best care possible. We've also developed a division that we call Wide Academy, where we want to become thought leaders on stem cell technology. This means that we are looking to provide accurate scientific and medical information to healthcare professionals. So if healthcare professionals are looking to know more about stem cells, they will have curated content for them, and also for the general population, so that when they are facing a decision tomorrow that involves either a stem cell treatment, or if they want to store their baby's umbilical cord blood stem cells, which I'm going to explain in a moment, they will be able to take an informed decision. The other division that we have developed is called WideCells, and that's where we are building or establishing at the University of Manchester Innovation Centre what we call the Institute of Stem Cell Technology, where we have started to provide support to stem cell research companies because we have clean rooms available, we have technical expertise to support stem cell research, and if a stem cell research company is looking for that service, we are able to facilitate access to our clean rooms and to our technical experts. The other segment included in WideCells is what we call the cryogenics division. And the cryogenics division is where we are able to process and store umbilical cord blood stem cells. And you might be wondering what is the importance or the relevance of umbilical cord blood stem cells. Well, you might have heard about bone marrow transplants. And bone marrow transplants have been performed as routine treatment since the 70s. So sometimes we hear the concept of stem cell technology, and it looks like this is a real new thing, an innovative technology. But the reality is it's been around for more than 40 years now. And there's more than medical evidence to support the use of stem cells. So bone marrow transplant normally occurs following high-dose chemotherapy for cancer. And it's been performed, as I mentioned, since the 70s. And doctors in the 80s found another source of stem cells which can be found in the baby's umbilical cord blood. So it can be collected immediately after birth. It composes no risk whatsoever to both the baby and the mother. And it can be stored for periods of up to 25 years to protect the family against future illnesses. We are talking about leukemia, myeloma, mainly blood diseases and blood disorders. But last year in November, there's the first FDA-approved treatment for cerebral palsy using umbilical cord blood stem cells, which means that doctors 20 years ago were thinking about blood cancers, and today these stem cells have the potential to now enter into what we call regenerative medicine. So stem cell treatments, if we go back 10 years ago, there were around 20 diseases that could be treated using umbilical cord blood. Today, there are over 80 diseases that can be treated using umbilical cord blood stem cells, and it's growing even more. So what are the problems before describing our solutions in detail? So first, there's lack of information, which needs to be addressed, because we have this technology available, and most people don't know what it's all about. And I'm talking about GPs, medics, I'm talking about obstetricians, dentists, plastic and cosmetic surgeons, and I'll explain the relevance of that. The other problem that exists in the industry is we end up having, for example, a family over in New Zealand. A family member of the nuclear family circle has been diagnosed with one of these blood cancers. So it receives a diagnosis from the local treating physician. Data suggests that 87% of people that receive diagnosis of blood cancer seek for alternatives. So they start to go online, Googling for alternatives. And that's not definitely the right way to do it, because there are several stem cell clinics spread all across the world that we would not be able to recommend. However, there are places such as the Great Ormond Street Hospital or the Mayo Clinic or the MD Anderson in the US that we can recommend. So there is no centralized point of information for a patient to access. And that's, again, a solution that we have developed. So in terms of company strategy, I've mentioned that Wide Academy has the mission to, let's say, inform or even educate healthcare professionals and expecting parents that face a decision of storing their baby stem cells. And we believe that by providing accurate scientific and medical information to both healthcare professionals and potential clients all over the world, the uptake for stem cell storage services is going to increase. And we have announced last week that Alan Greenberg, which is the former director of Apple Education, has joined our boards as non-executive director and VP of the Wide Academy division. So the former director of Apple Education that developed the iTunes U, the Digital Online Campus initiative for Apple, is now joined our company to develop the Wide Academy division globally. Then because again we believe the uptake is going to increase, we are establishing our own stem cell storage facility where we will be able also to store stem cells for families in Europe, in the Middle East, and also in the Far East. Now, there is a big problem in the industry, and that's the one that I have not mentioned yet. So today we have around 3 million people that have paid around £2,000 to store their baby stem cells. And they are mostly unaware that a stem cell treatment can cost up to £300,000. So I'll summarize. 3 million people pay £2,000 to store their baby stem cells all over the world, and they are mostly unaware that a stem cell treatment can cost up to £300,000. This means that the majority of families will not be able to afford treatments in case they need it in the future. So there was a need for a solution, and what we have built is CellPlan. And CellPlan is the world's first stem cell insurance plan, where we have developed 4 services included in one single product. We have Your Expert Consultation, which is the world's first expert medical opinion service to provide the right diagnosis, the right treatment plan, and access to the right treatment center. Then we have Your Medical Certainty, which is where we provide a comprehensive treatment plan, and our expert works together with the local treating physician and determines the proper course of action. Then we have Your Global Resource, which is a medical concierge, always a healthcare professional himself, that arranges for the whole bureaucratic process for the patient. This means, again, if we have a patient over in India that has been diagnosed with a disease that can be treated using umbilical cord blood stem cells, and if that patient has stored his baby stem cells already, he will be able to access treatments, for example, in the US. And what we will arrange is for travel, accommodation, transportation of the cord blood sample from India to the US, and we take care of the hospital admission process so that the family only focus on getting well. So we remove that burden from the family. Your Family Protection is where we provide cover of up to 1 million euros in Europe, worth of medical, travel, and accommodation bills, and outside Europe, we provide cover of up to $1 million. And that's for the whole family. I'm going to play a very short video that explains what CellPlan does.
Life is not always plain sailing. Let's say a family member becomes ill, and you find out they have a life-threatening disease. Well, you might need some stem cell treatments, which can cost hundreds of thousands of pounds. And you also need stem cells from your newborn's umbilical cord blood, which most people have not stored. Well, we're here to change all of that. CellPlan not only makes stem cell treatment accessible and affordable for all families, it also safeguards the future of your family, because the number of diseases that can be treated using stem cell transplantation is increasing dramatically. Here's how it works. Sign up to CellPlan, which is easy to do and affordable, less than £15 a month. And if you haven't done so already, collect blood left in your newborn's umbilical cord containing life-saving stem cells and store it for 25 years or more at one of our highly trusted cord blood banks. Members of our XL Global membership program. You can find your nearest XL cord blood bank using our search engine. And after your newborn's umbilical cord has been safely stored, you can activate your stem cell healthcare and then relax and focus on the important things, like enjoying family life and staying healthy. And if you should get diagnosed with a life-threatening disease, we'll be right there to take care of everything. You'll have access to the best medical minds. Get the right diagnosis and the right treatment right when you need it. Have peace of mind that you are covered for up to €1 million worth of medical, travel and accommodation expenses. And benefit from the best care and treatment worldwide, so you can focus on the important things, like getting better. We're CellPlan, the specialist provider of stem cell healthcare cover.
And there you go. This is CellPlan in a nutshell. And CellPlan, because we have this unique positioning and of being the world's first stem cell insurance plan, and also having the first mover advantage. If you look at CellPlan, we are doing for the stem cell industry what Denplan, for example, did in the UK for the dental industry. And the founder of Denplan is one of our non-executive directors, which help with the development of CellPlan as well. You have other payment plans such as Pet Plan and so on. The only difference is that CellPlan is addressing a global problem, not a more local problem such as only in the UK. So we have developed a model with CellPlan, which is very innovative in the insurance industry, where we have global reinsurance and insurance capacity. This means we can deploy CellPlan in any country in the world, and that's quite a unique proposition. So what's the business model? First thing is, we know there are 3 million people that already pay to store their baby stem cells. They know the importance of the service, but these stem cell banks are spread all across the world. We are talking about around 500 cord blood banks. Now, it's important for us, if we are insuring a family that has umbilical cord blood stem cells stored in an X cord blood bank, it's important that we confirm that those stem cells can be used in the future for a successful transplant. So we have developed a quality criteria for cord blood banks. They go through an application process, we review their application, and if they meet the criteria, they are then able to offer CellPlan. And we are talking about 2/3 of the world, around 2 million families that we can serve with our products. And this is growing at a very high rate. There's around 250,000 new umbilical cord blood collections in the world at this moment, and we believe it's going to grow even more because we are removing the costs associated with the treatment. We are converting a potential £300,000 bill into a £150 policy per year. That's the cost of CellPlan, including the 4 services for the whole family, £15 a month. So the model is we team up with the best cord blood banks, we enter what we call a referral agreement, and following that, we are able to offer CellPlan to the existing database of clients and also for expecting parents who are now looking to store their baby stem cells. So for each insurance policy that we sell, we generate around £50 in revenue. And we are targeting 100,000 policies in the first 3 years, 10,000 following the product launch, which will occur in 30 days, and then 30,000 policies in the second year, and 60,000 policies on the third year. This means that we will have an accumulated value of around 100,000 policies, we believe, by year 3. Now, when you're looking at our company, it's important to look at client lifetime value, because we have a very unique service proposition. There is no service similar to stem cell storage, because families are paying for a service that will be provided for 25 years. They are paying to have umbilical cord blood stem cells stored for that period. So if they have an insurance policy that will cover the costs associated with treatments for £150 a year, why wouldn't they renew the insurance policy also for 25 years? And we know in the insurance industry, people renew their insurance when they know exactly what they're buying. And in this case, it's very obvious. You have your stem cells stored, and now you have insurance for treatment. So that's, in a nutshell, again, is what CellPlan does. That's the business model. In terms of the WideCells division, where we provide also stem cell storage services, again, it costs around £2,000. We generate margins of around 60 to 70%. And Wide Academy division, it's a mixed model between free content for general population and paid content for healthcare professionals. Just as a summary now on WideCells Group, and to finish, we've listed the company on the main markets of the London Stock Exchange on the 27th of July last year. Our share price increased around 25%. We have some very good institutional investors on board. So there's much more to come. At the moment, looking at what we're doing is mainly on the number of agreements we are celebrating with corporate banks, who they are, so that we roll out CellPlan. It's looking at having our facility up in Manchester, where we'll be able to store stem cells up and running, which should happen in around 45 days, and having Wide Academy also being launched and driven by Alan Greenberg. So thank you very much, and I welcome any questions that you might have.